Howdy friends, your city manager here, Seth Sumner, with your daily COVID-19 update. It's Monday, April 20th, 2020, and I'll start, of course, with the Tennessee Department of Health data that we like to look at and keep track of daily with you. Good news to start out, McMinn County continuing our trend once again. We are still flat at 6 COVID positive persons. 4 of our McMinn Countyans have already fully recovered. Did notice that there was a question a couple days ago about what does recovery mean. So recovery is one of two things. Either that person was diagnosed over 21 days ago and has recovered. So there's a diagnosis period. They've been diagnosed, tested positive with COVID-19, and after that test period, 21 days has elapsed, and we may not have heard back from this person through the health department or through their healthcare professional, and so it's an assumption that that person has recovered. Or if that person has been confirmed as asymptomatic through the health department and has already passed through the mandatory isolation period. So those are the two techniques that are used by the Tennessee Department of Health at determining whether someone is recovered. So in one case, we have some way of knowing that yes, that person has recovered through the health department reporting, or there is an assumption made. We've not heard a reportable death, and that 21-day period has lapsed since their onset or the confirmed test of the onset of COVID-19. So that is how the Tennessee Department of Health is figuring that out. So I'll show you our map back here. Here we are, McMinn County. Great job. We are still at 6. And yesterday, out at Athens Regional Park and at the McMinn County Expo Center, we had several lines of folks, nurses, the Tennessee Department of Health, McMinn County Department of Health, as well as help from our heroes, the Tennessee National Guard, out there testing everybody that wanted to be tested. Reported to you yesterday we had over 300. We know that number now. Over 334 people were tested. And some of them, we saw some license plates from different areas. And that was okay. Everybody that wanted to be tested received the COVID-19 test yesterday. There wasn't anybody waiting in line when we closed. We let everybody through. That everybody got tested that came through Athens Regional Park yesterday, and that number was 334. You won't see that reflected in our numbers just yet because we don't have that being reported up through the system to the Tennessee Department of Health. But over the next few days, we will see that 334 added to our number, which is still a good, impressive number. We are doing a great job testing here, so that'll be added. What we're most afraid of, though, is we talked about last week getting through the surge. Here we are on our projections, and you can see there was a bump. There was a bump last week, and that was mainly due to that one day where we had 15 deaths. That was an increase in deaths by 14%. It is the only day throughout the entire pandemic since we started taking this data that we saw that large of an increase in deaths. Thankfully, those numbers dropped sharply since then, and deaths have remained very, very low. When we were expecting them to continue to increase, they've actually fell, so that is a good thing. We don't want anyone passing away due to COVID-19 or other issues right now. Our thoughts and prayers are certainly with those families who've been so heavily impacted by this virus, but that there are much fewer people being infected and dying is much better than we thought we would be at this time. So let me show you what that looks like. 152 deaths. across the state of Tennessee. There are now 7,238 cases of COVID positive persons, and that is going all the way back to when we first started testing. Everyone who is tested positive will remain in this number, even though many of those have recovered. And let me get to some good numbers there with the recovery. Recovered cases, 3,575. We're right at 49% of all cases. 49%, so half of all cases, those Tennesseans have fully recovered at this moment. So that is certainly a wonderful number for us to be looking at right here. Let me get my clicker working again. You can see that how hard hit, especially 21 to 60-year-olds, active adults, how they are leading the pack with the number of cases. But then you get into the lower age range and you see that there's not been a large effect of death in these cases. But what we are always being cautious of, and you've been doing a great job from the start, taking care of our neighbors in need, especially seniors and elderly, is because just about 1 in 3, 1 in 4 seniors, if they contract COVID, have a chance at dying. We have to take care of them. We've got to stay clean, we've got to keep our distance, and make sure they are getting the groceries and medicines and things that they need to remain in quarantine and away from the possibility of being exposed to COVID-19. We want to keep our folks around. And then you can see the difference in sex and race, ethnicity, and how different populations are affected on this. So we're still looking at only 2% of cases mortality rate across the state of Tennessee, which we were certainly worried that would be much higher. We're happy to see that remain a low number. This is incredible. If y'all remember the number we were at just yesterday, Sunday afternoon, just 24 hours ago where we're at, and now over 100,000 Tennesseans have been tested for COVID-19. And this is continuing to skyrocket. We're getting out there, we're getting the tests. They're available for all who want to take the test. And we saw that just yesterday with the Tennessee Department of Health Assessment Center set up in the regional park. 334 of us got out there and got tested. If you did not get in that line, if you weren't able to get out, but you still want to be tested, you can go Monday through Friday, 9 a.m. to noon, to the McMinn County Health Department and get your test. There's no charge. There's no charge, no lab fees, nothing like that. There's just a basic information that you'll need to fill out, and then there will be a nurse and National Guard on hand to help administer the test. And they were able to administer tests in about 1 minute. About 1 minute yesterday. And sometimes that can take up to 5, but still, you'll spend more time than that in the drive-thru getting some food right now. So go to the McMinn County Department of Health, just outside of the city of Athens, Monday through Friday, 9 a.m. to noon, and get your COVID test. And those are available for free. So we come down to our McMinn County numbers: 4 fully recovered, 6 total, and 565 tests that have been conducted in McMinn County. That, of course, does not count the 334 done yesterday. And there are also some other tests that are being performed through the health department. We're waiting to have these numbers updated. So really, today, tomorrow, we should be seeing likely over 1,000 tests that are being conducted in the county, and we want to see that reflected in our Department of Health numbers. Let me scroll over. We had looked at some of this. This is the University of Washington data set that we had looked at a few times on the update. And I wanted to share with you that again today to see, because this was early on projecting that we would lose nearly 5,000 Tennesseans to COVID-19. That was a very dire, very bleak looking circumstance that we would be seeing right now in our peak. But these numbers reflect a much better story for us. So mass gathering restrictions ended March 23rd. Businesses closed these are with Governor Bill Lee's executive orders. Certain businesses closed March 23rd. Educational facilities closed on March 20th. However, ours were a week ahead at March 13th here in McMinn County. Great job. Non-essential services closed April 1st, and stay-at-home order April 2nd. So we'll end up continuing through the entire month of April with our stay-at-home order from the governor. And I think we can look at certainly the educational facilities, some of our businesses and social gatherings, and the stay-at-home order as how we've really been able to get a grasp on the spread of this virus. We were looking at Surge Week last week, and what happened tells a different story. We didn't actually see that surge except for one day. That one day that we saw 15%, a double-digit uptick in deaths, but dropped sharply after that. So we are 6 days now past our peak. That was pushed back now that we're getting more and better data in. And our peak was that day last week where we had 15 COVID-19 deaths. That was April 14th. And so you can see here, we will be looking at a containment strategy. Governor Bill Lee has a task force that are already working on this to know what reopening our businesses is going to look like in the days ahead, getting into May and June, and then we're not going to be out of the woods with COVID-19. It's not going away. We have not got a vaccine. It will still be a threat to our population. But how do we get back to work? How do we get our businesses back open, but mitigate the threat until we can get a vaccine? Until we can be inoculated, how do we deal with it? That's what your leaders are working on right now. And I think this is a good time for me to mention to you again that I'll be working through the Council Advisory Committee here in the city of Athens to create an economic recovery team for the city of Athens. And so Ms. Patty Greek is chairman of the Council Advisory Committee, and she is working on that right now. We've been in contact, gathering that team, creating a task force to see what the good things that have happened over the course of this pandemic that we need to keep doing. What are the hygiene practices that are established that need to be daily from here on out? Social distancing. What businesses are closed right now? What do they need to help reopen? Hopefully in May, if we can get clear of the governor's orders, or there's new orders that tell us how to do that. So these are our citizens. These are experts in their own field, from banking to business to nonprofits, small business, construction, things of that nature. We're picking a team, putting those folks together, a real brain trust to start thinking about what's going to be Athens' greatest approach, how can we be successful and mitigate the threat of COVID-19 on through May, June, July, through the summer. Because we got to get back open. We got to get back to life. So here we are. We talked about the deaths per day. We also talked about resource use and what this was looking like. We saw that TEMA was adding another 7,000 beds ahead of the numbers that we were looking at based on these projections a few weeks ago, and actually no need, thankfully, because you are doing what you need to be doing. You're doing your part by staying apart. You're being responsible, you're using good hygiene practices, and that means we have much, much fewer deaths. We have much, much fewer infections because of that, because you're staying at home and you're being responsible. Thank you. This shows that we have only needed 282 hospital beds and 68 ICU beds during this entire time, and we were worried that this was going to stretch our resources, and we didn't need it because you're being responsible. That's incredible. That's teamwork. That's being a community. That's what we love to see. So here's just another chart showing you what that peak resource use looks like. And I've lost my clicker again. There we go. So then total deaths, we've talked about this as being early on in these projections as being just shy of 5,000 Tennesseans losing their life. And here we are projecting 231 total. Now we're not there yet. We're only at 152 today. We hope that it stays there. We pray that it stays at 152. We don't want to see another Tennessean lose their life to this virus. But our projections are showing now 231 total. And we'll probably see that into May. So I wanted to share all of that with you. Let me close that out real quick. And a couple other announcements before we sign off for today. Tomorrow, I hope you join us back here on the Daily Update. We will have representatives, either Brady Sewell or Erica Peden with our YMCA on the show to tell us about how they're taking care of folks in our community, feeding our folks, our families in the evenings, picking up where some of the other feeding programs are picking off. You can get breakfast and lunch for children through Athens City Schools. Folks still need dinner, and the YMCA has been picking that up. They also have a press release out today talking about child care. And so if essential workers, you're still at work, you still need to work, your kids are not in school during the day now, what are you going to do? They have a program that we'll talk about in depth tomorrow of child care for essential workers during the remainder of this pandemic. And so a lot of wonderful resources with our YMCA. We'll have them on to talk about it tomorrow. And then Wednesday, we'll have Mr. Kevin Lane with Coordinated Charities. And we've talked a little bit about Coordinated Charities already. They're certainly one of those groups that have been taking care of our vulnerable population, and especially with food and things of that nature. And so we'll have Mr. Kevin Lane, Coordinated Charities, on Wednesday for you to learn more about how you can help, or if you're in need, how do you get in contact with them and what they're able to provide. So if you want to be tested, go to the health department, 9 a.m. to noon, Monday through Friday. Anybody that wants to be tested can be tested. And we saw that happen yesterday with the assessment site. This continues all week, and I think there's going to be more programs. We're talking with the health department right now. We may be able to bring back a mobile assessment center back to McMinn County, back to Athens, and test even more people. So the more and more people we test, the more data we're able to have that show that we actually are through this pandemic, and we're starting to come down. We're starting to get ready to open our businesses up. We're starting to go back to work. That's what we want to see over the next week and a half, so we can get into May and hopefully kickstart our economy back into high gear where we left off right before this pandemic. But that takes all of us continuing to work together, being a team, being Team Athens, coming together, being responsible, using proper hygiene, socially distancing, and taking care of the people in need right now. You've been doing a tremendous job, and our numbers reflect that. Still, again today, only 6 McMinn Countyans have tested COVID positive during this entire pandemic. That's incredible because you're being responsible. I have one other reminder that I wanted to share. I know a lot of folks are at home, a lot of folks are online right now. If you have not taken the census, please go to census.gov, sign in, fill out the brief questionnaire. It takes a few minutes, but make sure that you get that recorded and responded back to the federal government. It is actually in our Constitution. It's mandated that we have a census every 10 years, that we're able to account for our people that are here, our population, and then our federal government uses that information to be able to redistribute our taxes. That's our money that goes to Washington. We want it to come back and be put to work right here in our home. And the only way for us to get that is for you to fill out the census and to be counted. So please go to census.gov and be counted while you have an opportunity right now. Let's get that taken care of. So hope everyone is doing well out there. I know it's been some beautiful weather the last few days. Thankfully, we weathered the storms again last night really well here. And I want you healthy. I want you happy. And we are ready to celebrate as soon as our governor and our president tells us that we can open up and we're back ready for business and ready for play and ready for summer. We're going to be ready to see you. May God bless you, and may God bless Athens.